we have Elisabeth Paulson presenting. So again, this section is about environment, and as humans, often our most notable interaction with the environment is through the consumption of food, in that we depend on the overall being of ecosystems and soil health to instill nutrients into our food. So this work by Elisabeth will present some holistic intervention strategies to encourage the consumption of fruit and vegetables among low-income populations.
Thank you for the great introduction. So yes, the goal of this work is to increase healthy food consumption among low-income consumers by informing food policy strategies. So we consider the problem of a government who has multiple different intervention levers at their disposal, and this work studies their optimal budget allocation across these levers. So it's well established that there are socioeconomic disparities in diet, and in particular, low-income households typically consume less healthy diets, including fewer fruits and vegetables on average. This is a serious problem as it leads to a disproportionately high rate of poor health outcomes among this population, including obesity, type 2 diabetes, and heart disease. And there are many possible explanations for this disparity. So the price of healthy food as well as nutrition education are likely to play a role. And additionally, the local food environment has been pointed to as a potential contributor to the diet disparity. So in food deserts, which are areas where many households do not have access to grocery stores, the diet disparity is particularly pronounced. In order to combat the socioeconomic disparity in diet, the government currently funds interventions in each of these three categories. So for a single low-income consumer residing in a food desert, of all the federal funds that are allocated to support that individual across these three types of interventions, about 94% are for price-related interventions, and particularly the food stamp program. About 5% is for nutrition education, and about 1% is for access-related interventions. However, funding for access-related interventions has actually been increasing in recent years, and even 1% is still hundreds of millions of dollars. Currently, funds are allocated in a seemingly ad hoc and siloed fashion, and there are a few key challenges that prevent a more strategic allocation of funds. So first is that there is debate regarding the effectiveness of certain individual interventions, and there's really no data-driven consumer behavioral model to help guide this decision-making. So first, we introduce a model of consumer grocery shopping behavior. We nest this into a bi-level model in order to optimize government investments for individual households. And we show that both levels are computationally tractable and that the model is actually able to predict empirical findings in the literature. We then use this model to derive new policy insights. So for example, we find that in certain scenarios, investing in access-related interventions is ineffective. And we also compare different price subsidies and find that some are more effective than others. And finally, we discuss how this individual level model can be used to determine group level interventions with performance guarantees for the realistic setting where completely personalized interventions are not feasible. So first, I want to give a bit more detail on each of these three types of interventions. So with respect to price interventions, there are many different types, and they can differ in one way based on which foods they apply to. So the National Food Stamp Program, called SNAP, is the largest example of an untargeted price intervention with a budget of about $60 billion per year. And it's untargeted because there are very few restrictions on which foods can be purchased using SNAP. This is contrasted with targeted price interventions that are geared towards specific food groups. So one example of a targeted price intervention is the Healthy Incentives Program in Massachusetts that provides rebates when households spend their SNAP dollars on fruits and vegetables. So one persistent question among policymakers is whether the SNAP program should be more targeted, and in particular, whether certain foods should be banned from the program. With regard to education interventions, typically the government provides funding to local, often university-run programs. And the idea behind nutrition education is that in order for it to change someone's behavior, it must first change their intrinsic value of eating healthy, which we refer to as their value of nutrition. And one key question in this area is, how should nutrition education be used in conjunction with other programs to increase effectiveness? Finally, with respect to access-related interventions, the government currently provides funding to local implementations. This can include building new grocery stores in food deserts, increasing healthy options at corner stores, or providing subsidized transportation to get to grocery stores. However, in practice, these types of interventions have seen very mixed results, often cases having little or no effect on diet. So naturally, some important questions here are, why do access-related interventions have mixed results? And when is investing in access actually worthwhile? So the overarching question of this research is, how should a government allocate funds between price, education, and access-related interventions in order to maximize an individual's consumption of fruits and vegetables? So to answer this question, we began by performing empirical analyses to better understand the effect of individual interventions. We then used these results to inform a bi-level model, giving way to new policy insights. I'm not going to focus on the empirical analyses, however, the paper's online for those who are interested. Instead, I'm going to start by talking about our modeling approach. So one aspect of the bi-level model is a model of consumer shopping dynamics. So to inform this model, we use the Nielsen Consumer Panel dataset focusing on low-income households. And for each household, over a year-long period, we calculate the time between all of their grocery shopping trips. And for each trip, we calculate the amount of money that they spend on fruits and vegetables and other foods. And so this is showing that information for 4 randomly chosen households in the data. And we assume that for each household, their decision about how many fruits and vegetables to purchase versus other foods, as well as their shopping frequency, is determined by solving their own personal optimization problem. So every household has a unique set of characteristics that play into an individual optimization problem, where every household needs to choose what food bundle to buy at the grocery store in order to maximize the utility that they get from that bundle, minus their shopping disutility, which stems from their shopping frequency. So every time a household goes to the grocery store, they pay some cost, which could be a combination of transportation cost as well as opportunity cost. And so all else equal, they would like to go shopping less frequently. Now, the government, which is the upper level problem, must decide how to allocate its budget across price, education, and access interventions in order to try to maximize the consumer's consumption of fruits and vegetables. And we assume that the price intervention impacts the consumer's food budget, the education intervention impacts the consumer's utility for different types of foods, and the access intervention decreases the consumer's shopping disutility by making it easier for the consumer to get to the grocery store. So typically with these types of bi-level models, they're often intractable. However, we show that for this particular problem, it actually admits certain properties that allow the optimal solution to be computed quite quickly. So therefore, this model can really be used as a tool to compute an optimal intervention bundle for an individual consumer. Additionally, we can analyze the model to gain broader insights into policy. So I'm going to present some of the high-level insights, some of which agree with existing empirical evidence and some of which are new. So we find that the education intervention always increases fruit and vegetable consumption, but the effect size depends on other characteristics of the consumer. We also find that the untargeted price intervention always increases both fruit and vegetable and non-fruit and vegetable consumption, and that households with a strong utility for non-fruits and vegetables should receive less of this intervention at optimality. And we also find that a targeted price intervention that specifically decreases the cost of fruits and vegetables is more cost-effective than the untargeted intervention. And finally, we see that in many settings, the access intervention will only increase fruit and vegetable consumption for households with a low value of nutrition. And this might be one reason why we see such disparate effects of access-related interventions in the literature. So far, the model that I've discussed pertains to a government choosing an optimal intervention bundle for an individual consumer. However, in reality, interventions are not tailored to individuals. So I want to briefly discuss how we can use this individual model to consider group-level interventions. And what I mean by that is that we can consider every individual being clustered into a group and then providing unique intervention bundles to each group instead of the individual level. So some important questions here are, what is an appropriate objective when we move from the individual level to the population level? We might desire some notion of fairness, and we actually look specifically at max-min fairness, which means that the government's goal is to maximize the lowest response level among the entire population. Some other questions are, what should these groups be and how many groups should there be? So we're able to provide an upper bound on the number of groups required to achieve a certain minimum performance level across the entire population. And in the Nielsen data specifically, we find that near optimal performance can be obtained using only 3 groups, where these 3 groups are formed by segmenting households based on their value of nutrition and their utility for non-fruits and vegetables. So while the model can be used to optimize individual intervention bundles, we can still use this model to get very near optimal intervention bundles across the population. And with that, I will conclude. Thank you.
Perfect.